All right, good evening, everybody. So let's get into the cardiovascular system. As mentioned earlier, you'll need to know the tracing of blood through the heart, and you can find that on the wall right behind us. All right, the cardiovascular system. So what does cardi mean, everyone? Heart. And that's what's vascular. So that is heart and blood vessels. Easy enough. So we have two circuits going to the lungs for oxygen, and then to the bodies for nutrition and waste disposal. So what happens in the liver? Things get broken down, it's sent to the blood, and then what filters out the blood? Kidney. Right? So that's the cardiovascular's role. It's the connective tissue. Cone shape, about the size of your fists. And which side of the heart is larger? Left side, right? So when you put your hand over your heart, it's usually on the left side. So which lung is larger? Yeah, so it's kind of opposite, right? So the left side of the heart is bigger, so that means the right lung is bigger. So here, the left side of the heart takes up a little bit of that lung space. So how many lobes in the left lung? How many in the right? So you can count them here. 1, 2, and that little guy here. 3. Because of that anatomy, if you were to choke, where do you think that object would be? In the right lung or left lung? Think about it. We'll cover it in respiratory system. We got the diaphragm. What type of muscle is the diaphragm? Smooth muscle. We can't control it because in the middle of the night, do you have to think of breathing? No, because it goes on automatically. Yep, involuntary. All right, pericardium. So there's going to be 3 pericardiums. So you got to make sure you keep them straight. So we'll go to the diagram as well. So peri means around. So when you measure the perimeter, you measure around an object, right? So this is the covering that's around the heart. But they give it to 3 different areas. So it gets a little confusing. So we have the visceral pericardium and the parietal pericardium. So the thing that is touching the organ is the visceral part. So there's a membrane on the heart. Touching the heart, that's the visceral pericardium. And then touching the cavity, the heart cavity, is another one. That is parietal. So visceral means organ. So it's touching the organ. So it has a second name, aka it's the epicardia, because it's above the heart. It's on top of the heart. So whatever's touching that top surface of the heart, that's the epicardia, aka the visceral pericardium. And then the heart sac itself, the thing on the outside touching the cavity, the heart cavity, not the organ, but the cavity, that's the parietal pericardium, which is the pericardium, right? So they use it 3 times to name it multiple, but let's go to the image and hopefully that demystifies it. All right, so the inner surface, endo, that's the inner layer of the heart. So that's where the blood will slosh around. Then you got the muscle layer, myo means muscle, and then epi, above. So that top surface that's touching the heart, that's the epicardium. Its other name is visceral. What does visceral mean? Organ. So the thing touching the organ is the visceral pericardium. Whereas this thing on around it, that is the pericardium, parietal. It's against the cavity of the body. So that's the covering that cavity. So we have the pericardium, which is this guy. We have the epicardium, which is also called the visceral pericardium. You guys okay with that? All right, so review this one. And all those prefixes will really help you. Endo, here's a word root, epi, for prefixes and suffixes. Epicardium. So what's the other name for it? Visceral pericardium, because it touches the heart. This is the muscle layer. Have you guys heard of myocardial infarction?
Yes.
That's when the muscle layer dies. Infarction is death. Endo, that's the inner layer. Endocarditis, that's an infection of the inner layer of the heart, and it usually affects the valves. 4 chambers. The top ones are the atriums. In between you have the septum. So inter is between, so between the 2 atriums. Then the lower ones are the ventricles. In between them, interventricle septum. And then dividing tops and bottom, we have the atrioventricular septum. So the atrial septum, ventricular septum, and then the atrioventricular septum. The valves. So the bicuspid and tricuspid valve, blood flow goes through them from the top down. Right? Tricuspid, here's your mnemonic device. I will try to get it wrong. No, right. So which valve is on the right side? The tricuspid. And then on the right side you have the, left side. This is right, this is left. So on the left side you have the bicuspid valve. It also has another name. Its name is the mitral valve. Bicuspid is also the mitral valve. And it also has a third name. We'll get to that later on. Now we have the semilunar valves. And these valves control blood going from the ventricles up and out. Right? So if I'm going to the pulmonary, where am I going to? The lungs. On the right side, you go to the lungs. And on the left side, this is the largest artery in your body, the aorta. On the left side. Now, when these valves shut during heartbeats, that's what makes your heart sounds, your lub-dub sounds. It's when these guys shut down. All right, you guys ready for the tracing? All right, so we'll start with the vena cavas. All right. So we have it coming from the top and from the bottom. So coming from the top, that's just the superior vena cava. Coming from the bottom, that's the inferior. So these are the largest veins in your body. They collect blood and they empty into the right atrium. So anatomically, remember, anytime you look at an image, you're going to assume that this is the right side, this is the left side, unless they tell you otherwise. And then we go through this valve here. Which valve is on the right side? What's the mnemonic device? I will try to get it right. Right. And then you enter the lower chamber, which is the right ventricle. Right. So the right side of the heart deals with deoxygenated blood. So they colored it blue. Right? But the word veins and arteries can be misleading. Right? Arteries always go away from the heart. It has nothing to do with oxygenation. That means veins always go back to the heart, right? So arteries away. That's your mnemonic device to help you remember your alliteration. Arteries pump blood away from the heart. Veins always to the heart. All right, so we left off in the right ventricle. So now we need to pump blood up and out So we have to go through the pulmonary semilunar valve. They don't have it here, but it'd be going through that guy right there. So there'd be a valve. That would be your pulmonary semilunar valve. And if I'm going away from the heart, what type of vessel am I? Artery. So you got your pulmonary artery, goes away from the heart. It goes, of course, to the lungs. Right? And then going back from the lungs, so what sends stuff back to the heart? Veins. Right? So that's where it gets a little confusing because people are used to, hey, veins are deoxygenated, arteries are oxygenated, but it has nothing to do with oxygenation. It's just pathway. Arteries away from the heart, veins back to the heart. So here now we go back. What chamber are we in? Yeah, we're in the left atrium. And now which valve is on the left side? Bicuspid. What's the other name for it? Mitral valve. Now we are in the left ventricle. And when the heart squeezes from the bottom, it needs to pump blood out. There's a little gateway here, this guy. So that is 11, the aortic semilunar valve. And then the largest artery in the body, which is the aorta. Not too bad. So if you're ever lost, just look in the back of the classroom. Previous students made that little diagram for you guys. So it's numbered and labeled.
You got it, Jake? This one's for you?
Got it.
Okay. Just want to make sure she saw it.
On the right page.
All right, cardiac cycle. So that's an entire lub-dub sequence. All right. So right atrium contracts, sends blood through the tricuspid valve. Blood goes through the right ventricle, and then it goes through the left side. Now they're talking about the left side. Left atrium contracts, bicuspid valve closes. So what they're saying is the top chambers squeeze at the same time. So these two things, 1 and 2, should be happening at the same time. The right and left atrium contract at the same time. So which way is blood being pushed? Down through the tricuspid and bicuspid valve. So the bicuspid and tricuspid valve prevent blood from going back up, right? Now 3 and 4 is when contract. So when they contract, they push blood up, right? So the two valves are going to be the semilunar valves, right? So they're going to prevent blood from going back into the ventricles. So what influences the heart rate? Well, of course, exercise, increased oxygen demand and use. Parasympathetic nerve. Is that flight or flight, or is that rest and digest? 50-50. Rest and digest. That means sympathetic nervous system that's your adrenaline. Flight, fight, fornicate, feed. Cardiac control center. So this is in your brain. So your heart has its own pacemaker right about there. But the brain can override it, telling it to speed up or slow down. So that's your basic life-sustaining functions in your brainstem. Body temperature. What happens when it's hot? Does your heart rate go up or down?
It increases.
Yeah, it usually goes up because your body's trying to pump that heat away. And when you're cold, it usually slows down. Potassium. You guys heard of lethal injection?
Yes.
What's the last thing they pump into your veins? potassium to stop your heart. So that blocks the electricity in the heart, stops the heart, and that's how they execute prisoners. Calcium ions. So calcium is involved in muscle contraction. Here in the heart, you have special calcium channels. Lub sound. Which valves are shutting when you hear the lub sound? So that means the ventricles are contracting. So you hear the lub dub. Lub dub sound. So it's kind of backwards to what we think. So the dub sound is the aortic and pulmonary valves. Heart murmurs. So abnormal heart sounds could be because of a leaky valve or the hole in the heart didn't close during birth. So you have a hole in the heart as a fetus. That's because your lungs aren't working. So we don't need to pump blood to the lungs while you're in amniotic fluid. So the hole in the heart lets blood goes directly to the left side of your heart. So from the right side, it just skips over to the left side, and then it pumps through the rest of the body because it doesn't need to go to the lungs. During birth, it should close, but if it doesn't close, then you'll hear that heart sound. Your pacemaker, the sinoatrial node. So it's in the upper right atrium, and it gives you about a 60 beat per minute pace. And these guys, they make their own pace, so it is true. If you take the heart out of the body, it'll still continue to beat. Right? It makes its own electrical impulse. It's the brain will tell it to slow down or speed up. It sends it then to the AV node, which is your secondary pacemaker. So if the SA node breaks down, this guy can kind of take over, but it's a little bit slower. Can't really keep you alive too long at 40 beats per minute. And then you have the fibers down the center. These are the bundle of His. So as they go down, they're called bundle fibers. But as they move up, the apex of the heart, they're called Purkinje fibers. We'll go to the image for those terms. So here is your pacemaker. So you have special cells that generate that electrical charge, and they'll need to communicate with the left side. So the right side and the left side need to contract at the same time. The AV node tells the ventricle to pause while the atriums contract, and tells the atrium to pause while the ventricles contract. Because if everything contracts at once, you don't have net blood flow. As they go down, they're called bundle fibers, and as they go up, they're called Purkinje fibers. How does your body create electricity? What's an electrolyte? Where can you get electrolytes? Gatorade, good. What's electrolyte is in Gatorade? Potassium, sodium, right? So things with a charge on it, and if we move it around the body, what did we create? Electricity. Easy enough. Pulmonary circulation. So our heart has two pumps, a right side and a left side. They work in tandem. The right side of the heart pumps to the lungs. So that is called the pulmonary circuit. So the right side doesn't have to be that strong because it's just pumping next door. Right? So that's why it's a little bit smaller. Now when the blood comes back to the left side of the heart, it needs to pump through the whole body. So that's a bigger job, hence the larger size. So to the body is the left side. That's why it's larger, because it needs to go through the whole body, the systemic circulation. Carbon dioxide, CO2, and other waste products. Have you guys heard of rhabdomyolysis? No? No CrossFit people? So that's when your muscles dissolve and all the waste product goes into your blood. And you can die from it. Your kidneys shut down because they have to filter out all those toxins. This is just a diagram of the pulmonary circulation. So right atrium, so this is from the vena cava, right? Superior and inferior vena cava, going to the right atrium. Which valve is on the right side? Tricuspid valve. And then we enter into the right ventricle. And then what valve is next? Pulmonary, because we're going to the lungs, right? So that's how you remember. Pulmonary, because I'm going to the lungs next. Back from the lung, what is this vessel called? Is it artery or vein? It's a vein. Good. Going back, it's a vein. So it goes to the left atrium. Which valve is on the left side? Bicuspid. What's its other name? Mitral valve. Now we're in the left ventricle. And then before we go out to the body, there's one more valve. That is the semilunar for the aorta. Here it is just pictorially. So going to the lungs here, and then going to the body. Arteries, as they get smaller and smaller, they are called arterioles. These guys have muscles in their walls. So this thick layer here is muscle because they're under pressure of the heart. Veins, on the other hand, not a lot of muscle. Blood is being flowed through them by your movement. Coronary artery. So the heart needs to feed itself. So the first set of blood vessels that branches off the aorta or the coronary arteries. When you get a heart attack, it's these arteries that get plugged up. Veins and venules. So as they get smaller, they become venules. And then the exchange vessels are the capillaries. So you notice here a lot less muscle, and they'll have valves. When you do your phlebotomy course, you'll learn how to deal with valves. Because as you insert a needle, you may get caught on a valve. You'll learn how to redirect. That way you can insert the needle. So flow of blood back to the heart is just by your muscle contraction. So when you wake up in the morning, what's the first thing you do? You stretch to get the blood flowing, and you yawn to get the oxygen in. All right, here we got the exchange vessels, the capillaries. And if you can see here, you can see the red blood cells. They're filing in one by one. And some of them are actually larger than the capillaries. They have to actually squeeze and deform to fit through. Have you guys ever heard of sickle cell anemia?
Yes.
Yeah. So sickle cell anemia is a trait where your blood vessels have this sickle shape and they can't fit through these capillaries, and they tend to bunch up and clog up. If you are, however, a carrier for the sickle cell trait, then you're immune to malaria. So that's why it still survived in our population, because it protects you from malaria infection. But if you have the sickle cell trait, you can't really deal with low oxygen levels or high altitude where there isn't a lot of oxygen. Capillaries are very leaky, and they're designed that way because that's how we exchange our nutrients waste. Hepatic portal system. So in your digestive system, everything that's broken down is absorbed, enters into that mesentery, and it funnels to the liver. So that's what hepatic is. So this is called first pass metabolism. So when you eat something or take a medication, it doesn't go directly into your bloodstream. Your GI absorbs it, sends it to the liver. The liver might change it before it sends it out to the blood. So it's kind of like a safety mechanism. If we ingest any toxins or poison, our liver can actually save us before it gets into the blood. So as mentioned, they're very leaky. So you'll get cells, salts, fluid that leaks out. So now that fluid is in between your cells and we'll need to reabsorb it. Have you guys heard of the lymphatic system? Right? Like lymphoma, cancer of the lymphatic system. So the lymphatic system runs parallel to the cardiovascular system, and it reabsorbs all this leaky fluid, all this fluid that leaks out of the capillaries. And since it's reabsorbing it, it'll filter it out through the lymph nodes, detecting any pathogens, and it'll take all that fluid and it'll dump it back into the cardiovascular system. So in the vena cava is where it reabsorbs and enters back into your blood supply. What is normal blood pressure? 120 over 80. All right, so the top number is the systolic. The bottom number is diastolic. So when your heart is in systole, it's contracting. When your heart is in diastole, it's relaxed, right? The ventricles are relaxed. So ventricles contract, systole. When they relax, diastole. When do you have hypertension? When you're at 140 over 90, right? And when you're somewhere in between, then that's pre-hypertensive state. Why do they call high blood pressure silent killer? Why is it called the silent killer? Creeps up on you slowly. You don't hear it coming.
Doesn't really create noticeable symptoms right away.
Yeah, there's not a lot of symptoms until it's too late. Once you get the symptoms, that's when the damage already occurs. When you start to get vision problems, when you start to get kidney problems, vision, headaches, dizziness, that's when the damage already taken its toll.
That's called a wife.
Oh, God. Please.
Cardiac output. So cardiac output is always over 1 minute time. So that's going to be the volume of blood that your heart can pump over 1 minute. So it's always not one heartbeat, but it's over a minute time. Cardiac output. So cardiac volume, well, that's one beat times how many beats per minute to give you your cardiac output, right? So let's say your heart pumps 100 mLs and you do 60 beats per minute. Well, that's 6,000 mLs, right? That's your cardiac output. 6,000 mLs per minute. Constriction, blood vessel open or closed? Closed. Dilation, blood vessel open. So some drugs that help you with blood pressure, what do? They open blood vessels. Some drugs help eliminate red eyes. What do they do to blood vessels? They make them shrink, right? So that's how Visine works. It does the opposite. Some drugs open them up, some drugs constrict them. So if you have high blood pressure, should you be doing this to your eyes?
No.
Because what will happen to the rest of your body? Same thing. It might give you a hypertensive crisis. Viscosity, that just means the thickness of blood. Viscosity is the thickness. So, of course, thicker the blood, harder it is to pump. So if you're dehydrated, your blood is syrupy, might be harder to pump.
That's why you drink lots of water.
Starling's law. So here, the more you stretch the ventricles, the more it pumps back. So the more you fill up the ventricles, the higher your blood pressure will be. So the more blood volume you have, the higher blood pressure you'll get. Right? So it's just like traffic. You have too much cars, too much blood, you're gonna get backup. So stretches the walls, the heart doesn't grow stronger, it actually gets weakened because it's getting damaged and being replaced with scar tissue. Scar tissue is not as elastic. So to check the pulse on an adult, you should check it in their radial artery. Don't check it in their carotid because this is where our baroreceptors are, our blood pressure sensors are. So of course, if you press it here, it's going to change the reading. So you should take it at the radial pressure. Now, when you stand up quickly, because of gravity, blood will drain from your brain. And to prevent you from being lightheaded, your pressure sensors will kick in and tell the heart to beat quickly for a few seconds upon standing quickly to keep that blood in your head so you don't faint. However, if you're taking blood pressure medication, your heart may not adjust. So for example, beta blockers, you can't get excited. So if you stand up quickly, the heart's not going to react. It's just going to keep on beating nice and slow, and the patient may faint. So you got to train them. Get up very slowly. Those are the ones on the side of your neck. Myocardial infarction, that's death of heart muscle due to lack of oxygen. So the first sign will be angina. That's just chest pain due to low oxygen. So it can be caused by activity. So the more activity you do, the more oxygen your body uses. So it's like the heart cramping. It's a heart cramp. Pericarditis. So that's inflammation of which layer? Yeah, the thing around it. So that is the heart sac, the parietal pericardium. Coronary spasm. So remember, these are the arteries that feed the heart, and sometimes they constrict on their own. And when that happens, you get a drop in oxygen in that part of the muscle of the heart, and you get pain. Hopefully, they relax and they open back up, and there's oxygen flow, and it doesn't damage the muscle. Heartburn, they call it that because it's in close proximity to where the heart is. The cardiac sphincter is the gateway between your esophagus and the stomach. It's a weak one, so just burping, passing gas can open it up, causing acid reflux. Let's see, costochondritis, so your ribs and the cartilage is inflamed, so because it's in the same area. Right, we'll just go quickly through the terms, and then I'll set you guys to break. All right, aneurysm versus a hemorrhage. So an aneurysm is it's about to blow. So it's a weakened area inside a blood vessel, and at at any moment, it's just like an inner tube of a tire that has a little bubble. It's weakened, and at any moment, if it ruptures, then it'll cause a hemorrhage, right? Bursting forth of blood. Arrhythmia, abnormal heart rate. So it can cause fibrillation, so atrial or ventricular fibrillation. The thing with atrial fibrillation is it can cause blood clots that can lead to heart attack and stroke. Endocarditis. Which layer is infected? The inner, right? And it usually affects the valve. If you get a dental procedure, sometimes the bacteria in your mouth and the cut in your mouth can then allow the bacteria to enter, and it'll travel through your bloodstream and it'll attach itself on your heart valves. That's endocarditis. So a lot of dental procedures, you'll use antibiotics prophylactically before the procedure. Inflammation of the heart muscle. Inflammation of the pericardium itself. Congestive heart failure. Just like traffic congestion, we can tell which side of the heart has congestion based on the symptoms. So let's say the right side of the heart has congestive heart failure. Where's all the blood backing up? Yeah, so this is where you'll find all the water retention. All the edema will be in the lower extremities. What about the left side of the heart? What comes right before the left side of the heart? So where will traffic back up? Into the lungs. So here, the doctor can look for fluid in the lungs. Oh, the left side of your heart probably has a problem. Or if there's a bunch of fluid in your legs or arms, I'm going to look on the right side of your heart. Because just like traffic, it's going to back up. Coronary artery disease. So ather is fat. So here is the plaquey deposits. And when they rupture, they can then lead to a stroke or heart attack. Arteriosclerosis, that's just hardening of the artery. Athero has to do with fat. Ather. Hypertension, when you're at 140/90, so they'll give you ACE inhibitors, beta blockers, calcium channel blockers, diuretics, vasodilators. So that's the A, B, C, and D's of hypertensive meds. And if that doesn't work, then I don't know. They'll sedate you. Mitral valve prolapse. Which side is the mitral valve on? Left side, aka bicuspid valve. So sometimes it doesn't close all the way. What is the hole in the heart called? No, the hole in the heart. That's the sound it gives, but there's an actual name for it. That's called the foramen ovale. So the guy's name is Ovale. A hole in the body is called a foramen. So it's the foramen ovale. So if that doesn't close, it may cause that murmur. Myomuscle, cardio heart, infarction, death. So it gets replaced with that scar tissue that's not as elastic. What's stenosis? Narrowing. So less blood flow, we can predict where the congestion is. Thrombo, clot. Phlegm is vein. So DVT, sometimes they call it deep vein thrombosis. So blood clot in the legs, it's a deep vein thrombosis. Varicose veins, if it happens in the anus, what are they called? Hemorrhoids, very good. What do you use? What do you use under your eyes, ladies? Preparation H.
Under your eyes?
Yeah, because it's a vasoconstrictor. So if you have puffy eyes, you put a little of that preparation H under your eyes and it reduces the swelling. He's all, I didn't know that. All right, with that life lesson learned. Let's go ahead and go to break. You guys don't have any online modules. We'll just take a look at week 1, day 1 when we come back.